We know stress enhances noradrenergic release and dopaminergic release. It has to, because stress increases arousal, right? Optimal stress helps us function. Optimal arousal helps us function, solve problems, because arousal is what's needed for cognition. Arousal is what's needed for movement, right? So essentially what stimulants do is they increase salience, which is amygdala's part of the salience network, right? They increase arousal, right? But then stress also heightens it. So what happens here is, in some cases, stress acts as a dose increase without pharmacological dose increases. So it increases noradrenaline dopamine tone through the mechanism of allostatic load itself, okay? So absolutely we look at stress as well. So now, at least from a treatment point of view, we know where a lot of this is coming from, because racing thoughts is very much a part of this emotional heightening, salience network heightening. And many of you know that we talk about the Mesolimbic hierarchy, where at the bottom we have sleep dysfunction, we have, as it moves up, we have irritability, racing thoughts, then we have anger discontrol, then hypomania, mania. As it moves further, we have agitation, ruminations, overvalued ideation, and right up at the top, we have psychosis. So the Mesolimbic hierarchy is essentially a hierarchy of activation. At the bottom, sleep, anxiety. At the top, psychosis, right? And this is essentially the Mesolimbic activation or salience network activation. So what we've got to look at is, where is this person at? Okay, so great. Good thoughts here. So which current feature most strongly suggests a superimposed activated state rather than a baseline ADHD alone? And this is what's important. We are not looking at carving at the joints or splitting. So we are not saying this is X now and not this. They are all connected, because we know that the frontal-striatal-limbic circuits are connected. So I'll draw it here to show you. We have the prefrontal cortex, we have the striatum, and we have the limbic areas. These are all connected. ADHD is essentially cognition expression and activity expression at the striatum, right? So that's what we're seeing as ADHD. Now we're seeing the emotional part as well. But ADHD always had these three connected. It's just ADHD as a construct forces us to focus here. That's the reason why the 9-step model becomes so important, is it helps us evaluate the limbic aspects as well. So which current feature most strongly suggests? Absolutely. So this patient was not sleeping for 1 to 2 nights. And the key question for us to ask, so often one of the questions is, how do we differentiate between what's hyperactivity of ADHD and possibly hypomania or mixed state? The decreased need for sleep is the phenomenological description that can really help. So asking them, do you find that you're still able to function reasonably well, or with relatively preserved energy, or feeling energetic? And most patients will say, yeah, it feels like I don't need much. I'm functioning in 2 hours, no problem. That is where the origins of hypomania begin, usually in sleep. It's increased goal-directed activity, right? Sometimes even trivial, along with sleep. So look out for those, because the full-blown mania or hypomania might come later. We need to pick it up early.